In the matter of a few short weeks, I have to have a little humor these days, things are tough. In the matter of a few short weeks, 22 days to be exact, the New Jersey health insurance marketplace will open for business, providing individuals and families throughout the Garden State with the opportunity, many for the first time, to access high-quality, affordable health insurance. Today there are roughly, as the Secretary said, 900,000 New Jerseyans, more than 100,000 right here in Hudson County, who currently lack health insurance and who will soon be eligible for coverage through the marketplace, and who will be able to receive, in many cases, tax credits and cost-sharing subsidies to make that insurance affordable. These folks are uninsured today not because they want to be, but because health insurance has always been out of reach. There are some for whom it's been unaffordable, or who have been or are self-employed and are unable to get employer-sponsored coverage. But whatever the cause may have been before, the solution is right around the corner. When the marketplace opens next month, it will allow people to start searching for and enrolling in new qualified health plans. These plans will be required to provide robust, essential health benefits such as hospital coverage, doctor visits, and prescription drugs, but also benefits for things like behavioral health services, which are especially important for those in the autism spectrum disorder, something that our state unfortunately has one of the highest rates of in the nation. It's a specific provision of the law I authored so that children and adults with autism and other developmental disabilities are able to receive the services they need to be able to fulfill their God-given potential. So I say that as an example of the nature of the benefits packages that are available here. Now, while we're here today to talk about the marketplace and the opportunity that gets unlocked by the Affordable Care Act, which I was proud to be an advocate for in the Senate Finance Committee to vote for, I believe in it strongly, let me take a moment to highlight what is often overlooked, how health reform has already helped the people of the Garden State. Since the law was passed 3.5 years ago, $10 billion has been refunded to people in New Jersey by insurance companies, averaging more than $100 per family, because an insufficient amount of the premium dollars were spent on actual health care. And under the law, there is a percentage that you must spend on actual health care, and if you don't, then in fact those rebates took place for these families. 3.3 million people, including 1.2 million women, and nearly 900,000 children no longer have to worry about hitting a benefit cap in their policy and being denied the care they need at one of the most critical times in terms of their health insurance needs. And particularly relevant as we stand here in the pharmacy, last year, seniors with Medicare drug coverage in New Jersey saved, on average, about $1,000 each on their medications, totaling savings on prescription drugs of close to $370 million since 2010. Those are the real benefits that are helping real New Jersey families already. Now, again, I want to thank John and everyone at Rite Aid, not just for making the effort to provide knowledgeable, trustworthy information, because there's a lot of misinformation out there, and guidance to people during open enrollment, but for their commitment to the community in the aftermath of Superstorm Sandy. He spoke about their actions, and I won't repeat it all, other than to say Rite Aid was giving the right aid to people who were in need at a critical time. And it is because of generosity of companies and organizations like Rite Aid that New Jersey has been able to come so far in the 10 months since the storm. So in a matter of a couple of weeks, the New Jersey marketplace will be open. It will provide hundreds of thousands of New Jerseyans access to quality, affordable health care that has been for too long unavailable to them. And this is one of the toughest things. Imagine going to sleep at night, knowing that you have no health care coverage, and knowing that an illness could put you totally having lost everything you worked for in your life. Knowing that you don't have the wherewithal other than an emergency room to take care of the health of your children. That was the past. When the marketplace opens, a new future begins. And while there are those who are trying to repeal, defund, or stop healthcare reform from succeeding without replacing it with any equivalent high-quality healthcare or with all the protections against pre-existing conditions that existed before, there are entities like Rite Aid who are working tirelessly to make sure it succeeds. And for that, they have our thanks. Thank you very much.